So fat grafting, so there's two types of fat that you can use, fat grafting. So mini lipo aspirate, which is really just baby liposuction. And mini lipo aspirate is done not like you see in the videos where you're using a big, huge tube to suck fat out. It's a small little cannula, and you just need a little bit of fat. So there are certain structures in your body that are made of fat, like the fat pad in the knee and other such areas where the fat acts as a cushion. And it's an important part of trying to help pain. So let's say I've got someone who I'm treating their knee. They've got some anterior knee issues, some patellofemoral pain, and I'm putting some PRP along in that retinaculum, along the soft tissue to try to shut off that chronic inflammation of that soft tissue. Well, putting a little fat in the fat pad helps a ton in those individuals. So that's kind of where fat comes. Now, there's another realm to fat. There are a few FDA approved devices to actually mechanically break down fat and to use it for cellular purposes like bone marrow. And some people like to think about it as, well, I'd much rather donate my fat than my bone marrow, right? And I get
Probably
that.
have a lot of volunteers lined up for that one.
Yeah. Moms are always like, I'll donate for my kid. But, you take someone of your build and you want to get off 60 to 80 cc's of fat. It's a lot of work. It's going to be uncomfortable. It's going to be painful. You're going to be bruised. And I may not get high quality fat. Whereas when you're using fat as a source of cells, and we're talking as a source of cells here, not as a cushion, when you're using it as a source of cells, you have to have a lot of, so the stem cells and the cellular matrix we're looking for in fat lives in something called stroma, which is like when you cut a steak, it's that gristly stuff. And so if somebody doesn't have a lot of stroma, you're not going to get the cells that you need. So if somebody is absolutely paranoid of bone marrow, or if they have a body habitus that makes it difficult to draw bone marrow, but they have plenty of fluff, then fat's a good option.